My name's John Bruning. I'm the Chief Executive Officer of the Australasian College of Paramedicine. We're the peak body for paramedics, representing and supporting all those working in emergency services across Australasia. Our focus is on improving person-centred care and also the wider utilisation of paramedics in the health system. Our key priorities are the recognition of the unique capabilities of paramedics and the role they can play in supporting better healthcare for our communities, and also the wider utilisation of paramedics in primary and urgent care. Paramedicine was a missed opportunity in relation to the Strengthening Medicare Taskforce. We were not included in that taskforce and able to have a voice there. And really it was formed with the existing players who have their existing view of the health system, and we feel that it's a missed opportunity for professions like paramedicine and other health professions that have been excluded to have an input into what the health system looks like into the future. If government is serious about healthcare and healthcare reform, then it needs all parties at the table and involved in the discussions in terms of what the new way of doing healthcare looks like. The task force spoke about team-based care, which we're very supportive of. At this moment in time, that's unclear if paramedicine will be a part of that team-based care that they're talking about. And it is a real opportunity for paramedicine to be involved. You know, as a profession, we bring those emergency, urgent, acute healthcare skills that aren't covered anywhere else, and paramedics should be part of that in terms of urgent care clinics, in primary care, community paramedicine. And these are not new models. Paramedics are working in this way all around the world. We just need to bring it to Australia and put it in place. Paramedics are unique in we're probably one of the last professions that still visits people in their homes, and paramedics are really comfortable in unscheduled, unplanned care in any environment. So it could be on the roadside, it could be in a workplace, it could be in a person's home. So the opportunity to utilise paramedics with primary care in the home is something that they're actually already doing day to day. I know a lot of people see paramedics and think about it's an emergency, someone's collapsed or had a heart attack or something along those lines, but actually most of what paramedics go to today is primary care. They are going to our community, generally who have chronic conditions with an acute presentation, and they're doing that in the home. So for paramedics to step out of the emergency response side and say work as part of multidisciplinary teams in primary care, you could well have the paramedic being the person that continues to go to people at their home, but in the non-emergency setting. So you might have the elderly, someone with a chronic condition, maybe not mobile, not able to come into a health clinic. The paramedic can actually be treating them in the home. And if we're doing it as part of a multidisciplinary team and a combined health record for that patient, you know, we still have the GP and the nurse back at the clinic able to see the care that's provided, and it's collated and kept together so that that patient record of the treatment they're receiving, whether it's the doctor, whether it's the nurse, whether it's a paramedic in the home, or maybe some other allied health service, such as physio or nutritionist, all that comes together in a record for the patient. So the paramedic is probably the only or the last placed health professional who's really comfortable in the home, seeing patients. And there's also a significant advantage in that as well, in that we have probably moved so far away from understanding a patient's real environment that they are living in. So often you could see a patient go to the health clinic, get different support and advice, but if you see their home, you might find that there's no chance of them taking that advice on. There's no chance of them being able to, improve their health. Whereas having a health professional who goes into the home, works with the patient, helps them with what they need to do to improve their health, and sees that whole environment, that actually will significantly improve the care that we provide to our communities. So I think that's one of the significant advantages that paramedics bring, and a real unique capability that's not covered anywhere else that paramedics can deliver to the health system. As part of the college's pre-budget submission to the federal government, we're proposing 30 community paramedicine pilot sites across Australia. These are collaborative and complementary addition of paramedics into the health system to support primary care. The 30 pilots will be in regional communities of need, addressing those communities' access to care challenges. They'll be co-designed with primary health networks, doctors, GPs and other stakeholders to deliver to communities the care and support they need. It costs $9.5 million over 3 years, which is really spare change in terms of the federal government's budget. To get into a bit more detail around that, it's a targeted approach to how we can support care between the ED department and the GP. That's really the big gap we have at the moment in terms of care, and that's actually the skill set that paramedics have. Each and every day they're working in emergency, urgent and acute care, treating patients, and if we can address that gap, there are significant savings to reducing hospital presentations and ED department and full hospitals. If we can care better for our community in the community rather than in hospitals, then that is the great advantage that we have. And so this will be done in partnership with primary health networks, GPs, health clinics, and all it's doing is bringing the paramedic skill set out of the emergency response with the ambulance service and putting it in the community setting, available there, working with doctors, nurses and allied health to deliver a more holistic care that our community needs. And really the focus is bringing that unique capabilities of paramedics to the table. And we see the GP as the captain of the healthcare team. And supporting that captain is a range of other health professions who can provide the care that patients need, so that really it's a one-stop spot for everyone to get the care and to have the health that they require. The college fully supports the Grattan Institute's report. I think everyone is aware of the challenges that we have in general practice, and the move to team-based care, as evidenced by the Strengthening Medicare Taskforce also focusing on that, really is the future of healthcare. What we see is a paramedic role working alongside doctors and nurses as part of that team. We still have the GP lead and directing, the patient care, but other health professionals being part of that team. In terms of the role paramedics play amongst that, is paramedics already provide quality healthcare. It's safe, it's independent, and they deliver it every day out in the community. They're on ambulances providing this care unscheduled in people's homes. So if we were to bring it into a GP clinic or a health clinic, paramedics are already highly qualified, degree qualified, registered health professionals, and they are able to play the role required of them to deliver that care in any environment. So actually bringing them into a clinic space, will actually make what they can do and give them the opportunity to work to their full scope of practice in that environment. In terms of safety and quality control, there are already many systems around clinical governance for paramedics in terms of the care they provide. But as we move into new practice areas, such as with GPs and other health services, the college is able to provide the support in terms of clinical governance and oversight that paramedics will need to support them to effectively work in those environments. We have an issue in healthcare already at the moment around healthcare records and how we are managing them across, our federated model, so between states and federal, between hospitals and GPs. So we already have this challenge in terms of, a complete record of what's going on with a patient. So the GP may be caring for the patient and that record is kept there, but then that person may be unwell and end up in hospital. And not always is that record brought together, and especially actually if you're treated while on holiday, say interstate at a hospital, that information doesn't necessarily flow back to being something available to your GP on the medical record. To go one step further now, we then have paramedics who are treating people in those acute presentations in their homes or on the side of the road or at the workplace. They have no access to any of that information. So paramedics and ambulance services are running on generally a completely different information system, and it does not give the paramedic access to the patient record. So paramedics are registered health professionals, just like doctors or nurses. They have access to patient records, but paramedics going to someone's home do not know what medication you're on, do not know what treatment you're having. And so if they're turning up and you're unconscious and no one else is home, A neighbour's called, they don't know what medications you're on, they don't know what you may have been having treatment for. The paramedic turns up literally blind to that environment, to providing care. And that's a significant issue in terms of the quality care that can be provided at that moment in time. So it's an emergency, and paramedics are stepping in with little more information than what a neighbour knows. Someone's collapsed, don't quite know what's wrong with them, and in the paramedic goes. And then we could have that patient on multiple medications, they've got numerous chronic conditions and comorbidities, and the paramedic has no idea about that. So they're trying to treat in that environment, really, one hand tied behind their back in terms of the care they can provide. And so, the digital transformation of our health records and connecting them together, and while I understand people might be concerned about privacy and the like, the fact is having a complete health record that is available to all healthcare professionals will significantly improve the care provided, and it's at the moment that it is urgent and vital that it's correct that you most want it to be correct, and for all that information to be available to the paramedic or the emergency doctor in that moment. If you're going to see your GP and you can talk through what's going on with you, then the full complete record is not quite as important because you've got it yourself. But if you are in a acute presentation, really unwell, can't communicate properly, that's when you want your treating health professional to have all the information so that you get the best care available. The college hopes that the health budget starts to move to a longer term, widespread reform view of the health system. We have had for too long, sort of gaps filled, issues identified and things added on consistently, and it's not helped by our 3-4 year election cycle and federal state government changes. We actually need reform. The system isn't working as it is supposed to, and so it'd be great to see obviously some work around what does the future look like. And I know we've got the Strengthening Medicare Taskforce, but that's just the Medicare aspect of it. What do we want the health system to look like in 10 years' time? And while the government can't deliver that today, and they're going to be putting out measures to continue to improve healthcare, we do need a vision and a direction for how we progress and completely reform how health is delivered. And that's the benefit of all our communities. We also need to focus on our regional, rural and remote communities, and especially our First Nations peoples. They are not getting the healthcare they need. We have significant challenges in terms of workforce in regional, rural, remote areas. And so I'd love to see something in the budget there that is specifically addressing that. We also need to focus on more cultural awareness and cultural safety training for clinicians. We do know that our minorities and First Nation peoples are not equitably represented in the healthcare workforce, so providing them culturally safe and aware treatment should be a priority. We've had a really challenging 3 years with the pandemic, and while our health professionals have been there caring for the community, their health has been struggling. It's been a very challenging environment for them. So I'd love to see something in the budget around the health and wellbeing for healthcare professionals and what we're doing about making the work-life balance for them and, the shift work and the rosters and the workforce, make it so that those people actually go to work loving going to work and feel that they're really valued and able to deliver the care they want to deliver because the system is supporting them fully. And probably the final one is around healthcare literacy. I think as the health system changes, we can't expect the community to use it in the right way. They'll use it in the same way they've always used it, unless we lift up the health literacy of the community at the same time. So often when I talk about what a paramedic does, if I go talk to someone in the community about what a paramedic does and they just think it's the person on the ambulance, well, actually a paramedic has significantly more skills than that and capabilities to provide so much more to the health system separate of that emergency response. So the more that the community can understand the capabilities of every health profession and what they can be doing, then we will be a large step forwards in terms of the community using the health system well, requesting to government what the health system should look like to meet their health needs. And that would be a fantastic thing to see.